17 essential service sectors are allowed to operate during MCO 3.0. Doctors may have to choose patients for ICU unit. Good evening. Thank you for joining us. You're watching a News at 10 with me, Azlani Adani. Only 17 essential service sectors are allowed to operate during the upcoming MCO period that will take effect from 1st until 14th June. Senior Minister for Security Datuk Seri Ismail Sabri Yaakob said this includes food and beverages, including for animals, health and medical care, as well as water and energy services. Explaining further, Datuk Seri Ismail Sabri said among other services that will remain operational during this period are security and safety services, solid waste and sewage management, as well as public sanitisation.
Pengangkutan melalui darat, air atau udara. Yang ke-8, perkhidmatan dan pengusahaan pelabuhan, limbungan dan lapangan terbang, termasuk pemunggahan, pengangkutan, lighter, pengendalian kargo dan pemaliman dan penyimpanan atau pemukalan komoditi. Yang ke-9, komunikasi, termasuk media, telekomunikasi dan internet, pos dan kurier, serta penyiaran bagi penyampaian tujuan penyampaian maklumat, berita dan seumpamanya sahaja.
The senior minister stressed that all of the essential service-related economic sectors would be allowed to operate from 8 a.m. until 8 p.m. However, he said daily markets would open from 6 a.m. until 2 p.m., while controlled fresh markets can operate from 7 a.m. until 12 p.m. As for permanent pharmacists market, My Farm Outlet and Area Pharmacists Association complexes, they will operate from 6 a.m. until 4 p.m., while wholesale markets will open from 12 a.m. until 6 a.m. and 11 a.m. until 4 p.m. Letters allowing interstate and inter-district travel from the International Trade and Industry Ministry, MITI, will expire tomorrow. In a statement by MITI, it said that the ministry will no longer be mandated to provide approval for sectors apart from the manufacturing and manufacturing-related services, MRS. Corroborating in a press conference this afternoon, Datuk Seri Ismail Sabri said companies are now required to refer to the relevant ministries regulating their sectors or the National Security Council, MKN.
Dengan pelaksanaan PKP yang baru ini, semua surat kebenaran perjalanan untuk bekerja yang dikeluarkan oleh MITI hanya berkuat kuasa sehingga 31 Mei ini saja. Tidak boleh lagi digunakan pada 1 Jun. Dan mulai 1 Jun, surat-surat kebenaran untuk bekerja, merentas daerah dan sebagainya hanya dikeluarkan oleh kementerian-kementerian yang berkaitan.
MITI also announced that manufacturing and MRS sectors listed will be allowed to operate subject to new approval letters downloaded from the COVID-19 Intelligent Management System 3.0, adding that 18 MRS sectors are allowed to operate under the MCO 3.0. 13 of the sectors are allowed to operate at 60% workforce capacity, while the remaining 5 are permitted to operate with a 10% workforce. On to the latest COVID-19 situation in the country. The Health Ministry reported 6,999 new COVID-19 cases today, a significant drop as compared to yesterday's all-time high of 9,020 infections. Health Director General Tan Sri Dr. Noor Hisham Abdullah said Selangor remained the state with the highest daily cases at 2,477 infections, followed by Kuala Lumpur 616 and Kelantan 612. Tan Sri Dr. Noor Hisham said 4 of the new infections were imported cases, while the rest were local transmissions. He disclosed 79 new fatalities in the last 24 hours, raising the country's death toll to 2,729.
Kes aktif dengan kebolehjangkitan semakin meningkat kepada 78,017 kes. Kes yang memerlukan rawatan di unit rawatan rapi iaitu di ICU ialah 846 kes. Ini kes yang telah disahkan positif COVID-19. Masih ada lagi kes sari yang sedang dalam penyiasatan.
The Health DG also said there are currently 419 patients in the ICU requiring respiratory assistance. 17 new clusters were reported today, bringing the total active clusters to 635. Meanwhile, Tan Sri Dr. Noor Hisham said the cumulative number of recoveries reached 484,787 after another 5,121 patients fully recovered from the deadly virus. The nation's recovery rate now stands at 85.7%. Doctors will be forced to make the tough call over which patient should be given a bed in the intensive care unit ICU due to the strapped healthcare system caused by the sharp rise in COVID-19 cases. Health Director General Tan Sri Dr. Noor Hisham Abdullah said if active cases exceed the capacity of the healthcare facilities in the country, doctors will have to prioritize ICU beds for patients with higher recovery potential. According to Tan Sri Dr. Noor Hisham, the number of available beds in the ICU COVID-19 hospitals as well as quarantine and treatment centres are declining due to the rising number of cases.
Di mana para doktor akan terpaksa membuat pilihan sukar untuk mengutamakan katil ICU bagi pesakit yang mempunyai potensi sembuh yang lebih tinggi berbanding dengan pesakit yang potensi sembuhnya adalah lebih kurang, iaitu poor prognosis.
He added that the Health Ministry has taken the initiative to increase the number of beds in COVID-19 hospitals and COVID-19 hybrid hospitals by repurposing certain spaces in the hospitals into ICU units. He said the Kepala Batas Hospital, Field ICU, as well as the proposed temporary takeover of the UKM Children's Hospital are also among the steps taken by the Ministry to increase ICU capacity. General practitioners clinics to be involved in national COVID-19 vaccination program.
Dan kes sifar untuk penularan tempatan.
Saat itu kita mengimpikan kemenangan. Namun, tak seindah impian. Ternyata bukan senang nak menang kalau SOP diperkotak-katikkan.
Welcome back. In an effort to boost COVID-19 vaccination capacity in the Klang Valley, the COVID-19 Immunization Task Force CITF will be opening more mega vaccination centres, PPVs. The Coordinating Minister for the National COVID-19 Immunization Programme, PICK, Kari Jamaluddin, said that from 7th June, several new mega vaccination centres will be set up in the Klang Valley.
Selangor kita akan tambah 3 PPV mega, iaitu di The Mines Convention Center di Seri Kembangan, di UITM Puncak Alam dan di Setia City Convention Center. Manakala di Kuala Lumpur kita akan tambah 2 lagi, iaitu di KLCC Convention Center dan juga 1 PPV mega di perkarangan Stadium Nasional Bukit Jalil.
He said this today during a visit to the country's first mega vaccination centre at the Malaysia International Trade and Exhibition Centre. MITEC, one of the large-scale PPVs, would begin operating tomorrow, where 2,600 vaccine doses are expected to be administered on a daily basis. Khairi added that he would be visiting states like Pulau Pinang and Johor to seek sites for similar setups there. He also said that the Ministry of Science, Technology and Innovation, MOSTI, will work with the Selangor state government to increase its vaccination rate following the surge of COVID-19 cases in the state. Meanwhile, the government aims to have 500 general practitioners GP clinics administering vaccines by 15 June. Khairi said a total of 1,000 clinics would be designated as vaccination centres PPVs by 30th June.
Dengan ini, saya harap semua pengarah kesihatan negeri dapat memudahcarakan penglibatan PPV bukan hanya di GP, tetapi semua PPV swasta yang merangkumi PPV General Practitioner, klinik swasta, PPV klinik pakar, PPV hospital swasta dan juga PPV pusat jagaan ambulatory swasta. So all the private healthcare facilities will make it very easy for them to be part of the national immunization program.
He said this in response to claims that private hospitals and clinics were not involved in the country's vaccination program. Khairi noted that before this, GPs were not involved in the vaccination program as supplies were insufficient. However, he said with increasing incoming vaccine supplies, it would be easier to rope in clinics and private hospitals to administer the vaccines for free through the national immunization program. The government has yet to decide whether to compound those who defaulted their COVID-19 vaccine jabs on the appointed days. Minister in the Prime Minister's Department for Parliament and Law, Datuk Seri Taqiyuddin Hassan, said so far taking the vaccination is voluntary and it is also given for free to the people.
Dasar vaksin ini pertamanya percuma, yang keduanya sukarela. Kerajaan belum lagi membuat apa-apa ketetapan mengenai perkembangan mereka yang gagal hadir selepas vaksin setelah mendaftar dan telah diberikan tarikh untuk mendapatkan suntikan vaksin ini. Jadi saya percaya kerajaan sedang memikirkanlah keadaan itu kerana kita tidak mahu berlakunya pembaziran.
Datuk Seri Taqiyuddin added that the matter will be handled by the Special Committee on COVID-19 Vaccine Supply Access Guarantee JKJAV as well as the COVID-19 Immunization Task Force CITF. He also expressed his disappointment on the failure of many residents, especially in Kelantan and Kedah, to show up for their vaccine jabs. He said those who did not turn up have been replaced with others in the waiting list to avoid wastage. Kedah Menteri Besar Muhammad Sanusi Makno today urged COVID-19 vaccine recipients in the state to turn up for their vaccination appointments. He said skipping the appointments without reasonable grounds was an irresponsible act that could lead to the failure of the vaccination program's objectives. The Menteri Besar said as there is a list of replacements available, he hopes there will not be no-shows, adding that it is an irresponsible behaviour. He said this during the visit at the Stadium Sultan Abdul Halim Vaccination Centre in Alor today. He was commenting on reports quoting Kedah Health Director Dr. Muhammad Fikri Ujang that some 10,827 registered vaccine recipients in the state had failed to turn up for their appointments between 19th April and 22nd May. Muhammad Sanusi also advised the people not to be influenced by unverified information on COVID-19 vaccine spread via social media. Following the surge of COVID-19 cases in Selangor, Tengku Ampuan Rahimah Hospital HTAR in Klang has decided to increase its number of ICU beds to 240 from 51 previously. HTAR Director Dr. Zulkarnain Muhammad Rawi said several normal wards would be repurposed to be used as ICU wards to fulfill the increasing needs.
Jadi ward-ward yang terdapat di Hospital Tengku Ampuan Rahimah telah di-repurposekan Maknanya telah ditukar fungsi daripada ward biasa menjadi ward ICU. Setakat hari ini, Hospital Tengku Ampuan Rahimah telah menyediakan sebanyak 51 katil ward ICU dan ward COVID biasa sebanyak 189.
Dr. Zulkarnain further explained that the situation remains under control even though the current ICU beds capacity in HTAR is almost at its limit with 98.3% usage. He said as of yesterday, 236 COVID-19 patients have been admitted to HTAR, with Category 4 patients recording the highest number at 155, followed by Category 5 patients at 30 cases. Nearly 12,000 individuals in Kelantan who have signed up for their COVID-19 vaccination did not show up to get their shots. The figure was recorded since the state-level national immunization program began, and the state government believes that the number will increase in the coming weeks. State Government Health and Housing Committee Chairman Dr. Izzani Hussein said Tanah Merah recorded the highest figure of those who did not turn up to receive their jabs, followed by Pasir Putih and Bachor. Dr. Izzani said the state government as well as the relevant authorities such as the health department have been doing their best to encourage the public to get vaccinated.
Bila kita first dose tu, kita sudah cover insya-Allah dalam 50% cover. Jadi hari ini solusinya ialah selain daripada kita minta rakyat supaya jaga SOP, semua masing-masing melindungi diri dan keluarga masing-masing, kita pihak kerajaan dan juga pihak kerajaan lah, insya-Allah akan menyediakan vaksin dan akan buat program vaksinasi ini secara besar-besaran. Dan perkara ini kita minta rakyat kita sambut dengan baiklah. Sambut dengan baik kerana solusinya untuk mengatasi ini ialah kita vaksin.
He said this to reporters after visiting a vaccination center at the Ketereh Community Hall today. Also present was Kota Baru District Officer Rosnazli Amin. That concludes today's edition of News at 10. In our top story, only 17 essential service sectors allowed to operate during MCO. Don't forget to tune in to updates at noon tomorrow on saluran Berita RTM on My Free Views channel 123. Or you can also stream the news on RTM Click website. Thank you. I'm Azlani Adani. Good night.